Hi everyone, welcome back to the Hair Loss Show. Russell, good to see you.
Thank you, Vikram. Good to see you.
In today's episode, I thought what we'd do is we do a bit of a recap. It's been a few years since we've talked about microneedling. It's been one of the most popular videos that we've done.
Absolutely.
And it's great because microneedling is a something that people can do in the comfort of their own home. They feel
cheap.
it's cheap. They've got control. They can do it in this. It's not about taking medication and people worrying about the side effects of that. So just, we've talked about it before, and I don't want to sort of labor the point, but I think microneedling is really good because it's creating tiny little pockets of damage within the level of the skin, which is essentially sort of stimulating, bringing growth factors in, stimulating collagen synthesis into the area. And
the knock-on effect is that the surrounding hairs get the peripheral benefit.
Exactly. And so that's the idea. So what I thought we'd sort of take on it today is go, right, okay, well, what's next? What else can we do with microneedling? How can we supercharge essentially microneedling to make it more effective?
So this comes into a couple of different areas of conversation. One is people who are fearful of ingesting medicines orally, and would prefer to do it topically. And so, for example, for many years, minoxidil, which started as a topical medicine, we've had that since the mid-1980s. But increasingly, people use it in combination with microneedling to increase the penetration through the skin, which seems like a pretty good idea on one level.
Yeah.
The thing to remember about it is that the microneedling channels don't stay open for very long, so you've got to do it in proximity.
Yes.
You can't microneedle and then 5 minutes later put the minoxidil on and expect that to work. You put the minoxidil on first, and then you microneedle, and then you go in. So that's one thing. The new things that are coming in, apart from medications, the things like peptides or exosomes as a new topical therapies, and again. People use them in combination with microneedling because they're trying to increase the absorption of these. Essentially, peptides and exosomes are filled with growth factors, right? So you're applying them to the scalp, whereas microneedling in of itself is using the growth factors naturally produced within the scalp. So you've got a bit of a double whammy effect there, if you like, where you've got your own growth factors and then you're supplementing them with other growth factors as well. So this is a very popular thing. The only thing I would put as a be careful on it is that people get a bit too enthusiastic about it, in my experience.
With the microneedling?
Yes, they think, if I do it, once a week, that's good, but twice a week's better, and
Or do it
3
deeper,
times a week is better.
sort of blood dripping down their forehead.
That's right. If you've got blood, you're too deep.
Yeah.
And if it's terribly painful, you're too deep.
The other thing to mention about that is when you're using minoxidil, it can sting even more because the alcohol will penetrate, and we know that topical minoxidil, certainly in the solution format, can cause a bit of scalp sensitivity in about a third of the population.
Yeah, so maybe it would be better with the foam.
Yes.
In that certain the minoxidil foam, which doesn't have as much alcohol or propylene glycol in it, and doesn't have as much skin sensitivity, might be more relevant.
And so, and the exosomes, it's a good point because right now with regulations per se, exosomes are not allowed in certain countries, that's for sure. And then there are other countries using plant-based exosomes. We're certainly not allowed to inject them, but you can apply them topically, and you can apply them using a derma roller as well. So there's the
so a lot of the restrictions on these things are based around whether they're human-based.
Yes.
Which gives the small, risk for the regulatory authorities whether you can transmit a bloodborne disease doing that. So that's one of the reasons why they're being regulated so tightly at the moment. Plant-based ones obviously get around that problem, and so do some of the animal-based ones that aren't actually human-based ones, which are not based on blood cells but based on other cells. And so I think these things are kind of interesting.
Yeah.
They've got to be carefully studied because one of the, if you like, the complicating factors is that there is a biological effect from doing the microneedling itself, and then there's the presumed biological effect of using the compound. And if you're using them together and looking at the result, how much of it is coming from the microneedling and how much of it's coming from the compound. So there needs to be a lot more emerging evidence in our opinion, at the moment about the use of these. So, for example, if you're using the products with additives like peptides or additives like the exosomes, as well as things like minoxidil, you need to compare it against not using the microneedling to be absolutely sure that you're not just really seeing the effect of the microneedling.
And then, so I mean, you talked about minoxidil with the use of with microneedling. How about other medications? Have you seen much of that?
Well,
being used?
people will use it with topical finasteride
Yeah.
as well. Again, this is people trying to reduce the possibility of side effects. I mean, it's a very legitimate concern for our young patients or any of our patients to use any medication that has the potential side effects, considering we are asking them to take it for a very long period of time. And they also want to know whether the side effects are reversible, which usually they are. So I think that this idea of using topical therapy and trying to increase the penetration in the skin of the topical therapy is actually valid.
Yeah.
For example, let's go back to minoxidil. It's extremely difficult to stabilize the solution past 5%. So, if you can't have a 7% working better or an 8% working better or a 10% working better to give the penetration through the skin, then taking 5% in microneedling might get around that problem. And so to me, I never recommend more than 5% because I know the chemistry of the medicine tells us that you can't stabilize it. So, if you think that you want to increase the absorption of minoxidil through the skin, microneedling makes sense.
Yes. There's also other additives that people use within, to add like caffeine or retinoic acid to try and also improve the
Retinoic
permeation.
acid is an interesting one, but it also is a skin sensitizer. So for some people, they get a dermatitis reaction. It's also photosensitizing, which means that you get sunburnt more easily with it. So again, these things are going to be used, cautiously if you're going to do this.
It's funny you should mention that. I had a patient who gave me a very interesting anecdote about that. I said, initially when I started using it, it was I burnt a lot easier with the topic with the retinoic acid in it, but then my hair thickened up and it doesn't burn as much.
That's right. So problem solved.
Yes, exactly. Cool. So that's there. So we can use it with minoxidil. We can use it with finasteride. I mean, the other
shallow, 0.5 to 1 mil, no more than that. It should 0.5 is probably enough for most people to get some penetration in there and not cause too much pain. And I also I want people to remember that with microneedling, you aren't damaging the scalp.
Yeah.
Right. So you don't do it too frequently. I would recommend to people once a week because you don't want to create micro scarring in the skin. That's the last thing you need is micro scarring in the skin.
Don't like doing it post-transplant either.
I think we're doing enough during the transplant. So that's a superfluous concept.
How about something else like dutasteride?
Yes, I'm skeptical because I think that the size of the dutasteride molecule is so large that I don't think that even if you use microneedling that very much of it's going to get into the scalp. I think dutasteride, has the possibility of being injected into the scalp, which is called mesotherapy. Unfortunately, like PRP therapy, it's painful.
Yeah, very painful
to do it. But the good news is, and we heard this from one of our colleagues in our meeting recently, was that she had to use it every 3 months, which I think is really, useful because if you're going to have people coming into the clinic and having to have it injected, having something like dutasteride that you can inject into the scalp and only have to do it every 3 months certainly seems like an advantage to me.
Yes.
The other way of getting meds in without taking them is to try and get them absorbed through the mouth. So there are newer versions now of what we call oral transmucosal films, OTFs, and they're just a very, very soft wafer that dissolves in the mouth, and it doesn't go through the gut, therefore it doesn't go through the liver. So you're not getting that central effect that taking a tablet or a capsule does for you. You're bypassing it completely. And the theory behind that is you get more in the bloodstream going to the scalp in that circumstance from the mouth being absorbed and going to the scalp. And in that situation, you probably may get a better result, and may reduce the risk of any side effects.
Yeah. Cool. Okay. So the OTFs is something that's coming, you can get.
They're a bit more expensive. Okay. So if you're price conscious, it's going to be hard to, to justify because they're probably 50% more expensive than the capsule.
Yeah.
But it's new technology and it certainly shows great absorption potentials, and for our patients that justifiably are concerned about having to take it and get the general potential side effects from swallowing it, this is a pretty good way around it, as is microneedling.
Yeah. Cool, great. Okay, well, I hope you enjoyed that sort of review on microneedling and how it can be used in combination with other medication as well. Well, very good. Well, thank you very much for watching this episode. Hope you found that useful. Please remember to like and subscribe to the channel, and we'll see you again on the next episode.
Thanks, everyone.
See ya.